Okay.
Yeah, we can start now. The meeting is live.
Okay, can everyone see my screen?
Yes, yes, we can, but I think you need to use present full screen.
Yeah, on it. The network. Okay, can everyone see it as full screen now?
Sure, we can.
Okay.
Hi.
Hello,
Hi, Farm Faith. How you doing?
I'm fine. Good evening.
Good evening. So good to have you on the call this evening.
Same here.
Wow, I can see the beautiful face.
Oh my God, you're beautiful too.
Thank you.
Yeah. It's good to
All
be here.
right, so
All right.
yeah.
Okay.
So we're gonna start right away.
All right.
Madam, are you ready or should I just go on?
Okay, yes, you can go on.
All right, so welcome everyone to another exciting episode of our Bele by Choice Facebook live chat. On today's live chat, we are opportunity to have an amazing person in our midst, an expert in the field, and of course, she's here to share with us on this. This discussion for today is kind of the topic. It seemed big, oh, that big grammar because I never hear her before. I just hear her for the first time, and that is why. Oh, sorry for the break, please. All right, so I said I really want to learn so many things today on today's discussion because this kind of disease, whether not disease, whether not virus, I don't feel differentiate am because as at now no before now me I don't know wetin this postpartum means until today wey I come hear am so as we dey so we wan hear from our doctor make she dey yarn us better talk. So my dear people wey dey for the screen wey dey watch us for there, no fail to dey free to share with us. If you get any comment, make you drop am for the chat or for the message there. We go come back to am, come share am with our speaker, and she dey here gidigba. Make she give us that information wey we need. So I wan make all of us, women or men or make una mind dey open because say today we go learn plenty things. As we dey so today we wan discuss about this important topic. But before we go continue, we wan just use this opportunity to say thank you to our better partners for their support wey they don give us. And Bele by Choice dey run today because of them. So we dey say, we're saying a very big thank you to you, African Women's Development Fund, Global Fund for Women, Women First Digital, Moment for Women Alliance, DKT International Nigeria, Cross River State Ministry of Health, UNFPA, and Cross River State Primary Healthcare Development Agency. Thank you so much for your support. Bele by Choice is running because of you. So we're saying a very big thank you. We're grateful for being by our side, for being our pillar. Yes. So thank you so much. Thank you so much. And then we're also going to say a very big thank you to our speaker in the house, Dr. Faith Oji. Really, at first, when I heard the name, I was like, oh, wow, who is bearing this beautiful name? And then at some point, I was thinking, we actually had one speaker that had such name. And then I was like, are we having the same person again? And then not until we see the beautiful face. Okay, so Dr. Faith Oji is a dedicated medical doctor and alumna of Obafemi Awolowo University. Is a
Wait, before we even continue, let her say hi to us. Dr. Faith, are you with us?
Yes, I am.
that's
Hello.
fine. Sure.
Hi.
Hi,
Hi.
welcome. Thanks for joining us.
Thank you.
Okay, so should I take it from there?
Okay, yes, you can.
Okay, Dr. Faith Oji, she's a dedicated medical doctor and an alumni of Obafemi Awolowo University. She's a staunch medical health advocate, wow, and a prolific writer. Our mission revolves around illuminating the significance of mental health within our societal fabric. Thank you so much. We need a lot of you advocating for mental health, because as Nigeria is going now, a lot of people are actually having mental health issues, but they don't see it as mental health issues. Most people just feel like when it comes to sickness, it's only malaria and typhoid, but there's more to it, especially in the case of mental health. And most people don't really know that they have mental health issues. So thank you very much. And then she's also driven by a fervent desire to empower young professionals. Wow. She guides them in making life-altering decisions. Can you be my mentor? Nurturing their potential to catalyze transformative change through our commitment to community welfare. She actively discussion on holistic well-being, bridging the realms of body, soul, and spirit. Wow. Dr. Faith, are you with us?
Yes, I am. Thank you so much.
Thank you for joining us on the call. Thank you for coming to throw more light on postpartum psychosis, because it's we know in this part of the world, people don't really know any other form of disorder. In fact, most people don't even know disorders when it comes to mental health. And this platform, and you with us on this platform, will actually help us throw more light on postpartum psychosis. Thank you very much for joining us. Tina, are you there?
Yes, okay. I'm here. Just give me a minute.
Okay.
Hello?
Sorry, I think her network is breaking.
Yeah, I think so too.
Okay. So let's just, sorry, please, can you give her a minute to get her network back?
All right.
All right, I'm back. Thank you so much, Ronke, for that brief intro. And then I would say, Doc, I've actually learned so much about this from your profile alone. I know that this one, you are a Ronke woman. Yeah, so we'll be going straight to the discussion proper. And then our first question is, what is postpartum psychosis and how does it differ from other prenatal mental health conditions? I hope you can hear me.
Yeah, I can hear you. I can hear you.
All right, so
okay, can everyone hear me?
Yes, we can.
Okay, all right, that's good. All right, so thank you for having me. I'm honored to be here, and I hope we all learn one of the things concerning postpartum psychosis today, so that we can, help the community at large. That's the whole essence of this. All right, so the first question is, what?
Hi, doctor. Please, can we just see a beautiful face? That's beautiful.
Yeah, you can. Can you see it? You should be able to
yes,
see
yes, yes. Yeah.
Okay,
perfect.
All right. It's okay, good. That's good. All right. So the first question is, what is postpartum psychosis and how does it differ from other parental mental health conditions? Okay, so we're going to break down this one to two words: postpartum, then psychosis, right? So anything postpartum is within 6 weeks after birth. That's what medical doctors term postpartum. Then psychosis is any severe mental disorder in which contact with reality, okay, is lost or is distorted. So basically, postpartum then psychosis means that it's a disorder, a mental health disorder that occurs within 6 weeks after birth in new mothers, in which the contact with reality or is lost or is highly distorted. So basically, it's a mental health disorder. It's grouped into bipolar disorder, okay? And in the medical setting, when a patient comes to us and has symptoms of postpartum psychosis, it's actually a psychiatric emergency, okay? So how does it differ from other perinatal mental health conditions? Okay, so basically, there are other conditions, mental health conditions that occur to new mothers. But the two most common ones we have are maternity blues and postnatal depression. Okay, but for us to be able to know how it differs from those other two conditions, so I would like to shed more light on what postpartum psychosis is. So basically, in this postpartum psychosis, within 6 weeks of delivery, the mother begins to have symptoms that are not in keeping with the normal state. She begins to have psychotic symptoms like delusions and hallucinations. Okay, so delusion is basically you not being in contact with reality. Okay, like bases that have no contact with reality. And then hallucinations is you're seeing or hearing things that are not there. We are in a Zoom meeting now, and then I'm talking to you and I'm assuming someone of you is talking, like everywhere is quiet. I'm the only one talking. Where did you hear another person talking? I'm like, no, I can hear another person talking. That's an hallucination, okay? Or seeing something that's not there. Meanwhile, it's saying, okay, I'm seeing you right now, and I'm seeing like 10 people behind you. Hello, there's just only one lady, beautiful lady sitting across me. So where are you seeing the other 10 people? And the patient is adamant, I can see 10 people. Oh, okay. So that's what we call hallucination. We call it auditory hallucination. Okay. So the patient also has anxiety and anxious symptoms.
Dr. Faith, Dr. Faith,
Yes.
I
Yeah.
can hear you, but I like the flow, but you're a little bit too fast.
Too fast. Oh,
Yeah, I'm telling
okay.
you.
Sorry. I'll calm down. I'll calm down. Okay.
Okay,
All
thank
right.
you.
No problem. It's all right. We're all here to learn. Okay.
Yeah.
So for postpartum psychosis,
Yeah.
the patient has psychotic symptoms. What are the psychotic symptoms? There are delusions and hallucinations. A delusion is a belief that has no basis in reality, simply put. Then an hallucination is when someone sees or hears something that is not there. I give an example of this Zoom meeting. I am talking to you right now. I'm the only one talking. And then let's assume this other patient is here. She will say, oh, there are like 4 people talking. And you can obviously see that it's the only one talking. And she is adamant that, okay, there are 4 people talking, everyone talking. When you hear things like that, you know that the person something is wrong with the person. Isn't that what everybody would think?
Yes, true.
So, or when the person is hearing things that are not there, like we are 2 people now having a conversation, I'm the one talking most of the time. This person will say, oh, they're like, how many people are talking there? You people are plenty, oh. They're like, a lot of people talking. Like, no, I'm the only one talking, which you can obviously hear. But no, there are a lot of people talking, something like that. So, and the person is adamant, like, what is it? So that's another symptom. We call it hallucination or auditory hallucination. So these are all like symptoms a patient, someone with postpartum psychosis will have. Why I use patient is because it's a mental health disorder. It's not normal. Okay, it's not normal for a woman to give birth and then she starts saying things that are irrational, things that don't make sense, that every other person, including their husband, can say, this is this, why are you doing this? Okay, so she changes all of a sudden. A child is a thing of joy. When anybody gives birth, we are all happy. This new mother rather behaves in a confusing way. She's so irritable. She is agitated unnecessarily. She doesn't like bond with the baby like you expect any mother to. She has thoughts of suicide, like of harming the child. Like she feels like, oh, maybe this child is malformed, is deformed. Let me just help end your life. So talks like that. Those are not normal in a new mother. It's not normal for you to have a thing of joy and then you think of harming the child. So when you see things like that, oh, this is not normal, we need you to go see a doctor. Okay. Now, for how it differs from other conditions is like for perinatal depression, that one is mainly a depressive episode, okay? The new mother is down. She just had a baby, but she's not just there, okay? So for postpartum psychosis, it usually occurs within 1 to 2 weeks after delivery, okay? That's when we usually see, that's when it peaks, 1 to 2 weeks after delivery. But for postnatal depression, they can occur like within the first 3 months, not necessarily like the first or 2 weeks, first 3 months, okay? You just notice that this woman, what happened now? Just down. This is a baby. We are doing naming ceremony, this and that. You're just there. Well, I hope you're okay. She said, yeah, I'm fine. This one I used to know that I used to do like this. Why is she, So all those kind of things, you start seeing it. So, and then in countries like ours, we live in a third world country. Or some people might argue and say it's a developing country, whichever one. It's predisposed to occur more here. He has the higher chances of occurring here than in developed countries. And the reason is not far-fetched. Like, we can see the economy right now. Nigeria is just hard to a lot of people. Just imagine giving birth to a baby, giving birth to a baby that she did not plan for. Okay, so all those things increases our chances of coming down with postnatal depression. And so in postnatal depression, they don't have the
Dr. Faith, are you still with us? I think our network is breaking.
Hello?
Yeah, we're with you.
All right, perfect. All right, so for postnatal depression, usually comes from the risk factors, loss of sleep. You just had a new baby, a mother is not sleeping well. A lot of hard work involved in the baby's care. The mother most of them they've had like previous history of depression. Maybe while she was single, or even while she was married, she had seen a psychiatrist before to treat depression. All those kind of things increases a woman's chances of coming down with postnatal depression. And then also if she doesn't have supportive, partners, a partner that's not supportive, all those things will increase her chance of coming down with depression. So basically, in postpartum psychosis, this person has thoughts that are not in contact with reality. This person is delused, person is hallucinating, person has thoughts of having the baby. Okay. But in postnatal depression, she's just down. She's just a little bit sad. She has fears. In postnatal depression, she has fears that she will harm the baby. But it's in the postpartum psychosis, she actually wants to harm the baby. That's like the difference you see. So a postnatally depressed woman will be like, oh my God, like she's scared that she will harm the baby. While for a woman with postpartum psychosis, she is taking of harming the baby. So that's like a big difference between the two. So that's how you used to like differentiate them. I hope you can get that.
Yes, I totally understand that the difference between
Sure, we can.
But if I may ask, that means it's just restricted to mental. No other like organs are not affected. No organs are affected.
No.
Maybe fever and all of that. No.
Not at all. Not at all. Not at all. It's a mental health disorder. That's why I
Mental
tried to
health.
define it. Yes, that's why I defined it when we first started the meeting. Postpartum then psychosis. Psychosis is any belief that is not found in reality. That's of the mind. Why postpartum is anything occurring within 6 weeks after delivery. So put two of them together. It's a mental health condition that occurs within 6 weeks after delivery, in which there's no basis to contact in reality. Contact with reality is distorted. Okay, you are thinking, or I was thinking of killing your child. You are thinking someone else is saying something that you're hearing things that everybody else is not hearing. You're seeing things everybody else is not seeing. You're talking irrationally. You are just irritable and you're anxious.
I can imagine that.
Yeah. So let me
All right.
put it.
Thank you so much for that.
They'll really be just the same way we are talking right now. That's the way they'll be talking. They'll be so sure, like they're sure of their names.
Really?
That's exactly what they are saying. So you just need to be aware and take it easy on them. Yeah.
Wow.
Okay, over to you.
Wow. Thank you so much. Thank you so much for sharing that. It's really helpful. Initially you wouldn't really know how to differentiate the both, but from what you've just explained, it has given a clearer picture of what differentiates the both parties. All right, so on our next question is, what are the common risk factors and triggers associated with postpartum psychosis, and how can they be identified? Hi, doctor, can you hear me?
Hi.
Yes, we can hear you.
Okay, because it
Yeah.
got blocked at the point. All right. Okay, so I can go
Oh,
ahead.
sorry.
Okay.
Yeah.
All right. Okay, so the common risk factors, how do I put it? So basically, for patients with postnatal depression, like they're okay. It's just a depressive episode. We can easily, like, they don't even need to get treated, right? Patients with like maternity blues, they're okay. It's just a new baby and they just have one or two thinking out of place. That's okay. But patients with postpartum psychosis, those patients, they are now different. Since it's a psychotic disorder, usually the risk factor for that is any patient with a mental health illness, and not just any mental health illness, a mental illness that involves like a bipolar disorder or a schizoaffective disorder. Forgive the medical terminologies, but I have to be exact with that because okay, have you heard of anything called schizophrenia before?
Yeah, I guess so. Yeah, we have.
Okay, all right. Okay, so patients like that, women that have been treated for that before in the past, when they want to get pregnant, or when they want to get pregnant, yes, their chances of coming down with postpartum psychosis is high. It's higher than any normal woman here who has never been treated for that before. Okay, so it's a psychiatric illness, so that's a very strong risk factor. Okay, patient that has had this in the past, in her previous pregnancy, she was seen by a psychiatrist for postpartum psychosis. Most likely, not surely, most likely come down with this. Okay. Then if you have had, or anybody here has had a history of postpartum psychosis in a close relative, auntie, sister, your own chances of coming down with it is also very, very high. Okay, it's like a family thing. And women that are just giving birth for the first time, we call them primiparous women. Okay, so studies have shown that they also have high risk for coming down with postpartum psychosis. So once these factors
What
are there,
about what about people who suffer from violence, maybe violence in a relationship, physical violence, emotional violence, all form of abuse? Do they have chances of coming up with this?
yeah, those ones I will call them triggers. I'll call them triggers, right?
Okay.
Imagine having those type of triggers and having a history of having the increased risk factor for coming out with postpartum psychosis is a bad one. Like the chances that that girl will have postpartum psychosis is so high.
It's high.
Like you've been treated for it in the past, and then you now have one abusive partner. That will affect the woman's mental state. Okay, and let's just assume it's not a first pregnancy. It's a really bad recipe, I would assume. So triggers, I'll call them triggers. Things that can precipitate one to have postpartum psychosis. Sleep deprivation. Okay, we all know that motherhood is a demanding journey. Okay, just imagine a new mother having to care for a baby without much support, without in-laws being around or having relatives who can help her out, and then having a risk. Not even, she might not even have a risk for having it. Okay, because studies have actually shown that almost half of women that have postpartum psychosis don't necessarily have a risk. They've not had the risk in the past. They've not had it before. They've not been treated for a mental health illness before. They don't have a relative that had it before. Okay, so they just had it. It happens. Okay, so just imagine a new mother being sleep deprived, a new mother having reduced partner support. The man doesn't care. It's not there. It's not emotionally available. It's not financially available. Or even in a case of unintended pregnancy, okay, unintended pregnancies, the chances will really be high. Okay, we didn't even plan for this baby, and now we've had it. So women like that, there's already a lot of issues surrounding them, so they will surely, most likely, come down with it. Of course, when you have a case of domestic violence too, relationship difficulties too, okay? Relationship difficulties within families. That's one reason why I'm so passionate about mental health, because there's just a whole lot of things that happen in life that a lot of people don't plan for. that happens. So you just have to care, you just have to listen. A lot of people are coming from their own baggage. So you just have to care. Yeah. So all those things, I'll call them triggers. They can trigger any woman into coming down with postpartum psychosis. Yeah, so that's it.
Okay, thank you very much, Dr. Oji.
Yeah.
Before we move on, you know,
Thank you
I think
so
someone wants to say
much for
something.
sharing that. You know, yeah, while you were talking, you mentioned about hereditary. You mean postpartum is hereditary?
No, I don't think I mentioned the hereditary, but research has shown that there's not really any genetic predisposition. But however, they found
Okay.
something that has to do a local chromosome 16, but it has not really been well established actually. So when it comes to mental health illnesses, there's a whole lot of theory we can postulate. Most of them childhood traumas, most of them growing up, most of them just people living around you, how you grew up. All those things, like I mentioned, all those triggers in quotes can cause people to come down with psychiatric illnesses. Because sometimes when you check these people with um, this mental health patients, right? Most of their family members are normal. But if you dig deep, you find out that there's a whole lot going on. Okay, so it just can happen to anybody, really, just anybody.
Well, thank you so much for sharing
I
that.
have a
That's
question
so
before we move to the
amazing.
next question.
Yeah, please go
Okay.
ahead.
All right. Can you tell us how rampant is this and how rampant is postpartum psychosis in Nigeria especially?
Oh, well, in Nigeria, I can't really give you data in Nigeria because much research has not been done. We are still coming up in terms of psychiatry, mental health. But globally, just 1 to 2 out of 1,000 women, new mothers, usually come down with it. Yeah.
All right, thank you very much. So moving to the next question.
Yeah. Okay. So the
All right.
next question.
Thank you so much for that. All right.
Thank you
So
too.
our next question is, how can women and their families recognize the symptoms of postpartum psychosis, and what steps should be taken if someone is experiencing these symptoms?
Okay. All right. So for symptoms in postpartum psychosis, yeah, usually
Sorry,
psychotic
doc.
symptoms. Yeah.
Sorry, doc. Can I request for one favor?
Okay, please.
All right, so on the platform through which we operate, not everybody understands, the level we are going. So we are going to be breaking it down and mix it. Our own will be Belle by choice party. So we'll go mix the pigeon inside so that others will understand.
All right. All right. All right. No wahala. I get you. I get you.
Hey. All right.
Okay. So, all right.
All
Now
right.
let's break it
Oh yeah.
down. Okay. For postpartum psychosis, so they usually have first of all, they have something we call delusion. Like say, person get belief wey no dey for reality.
Okay.
What example will I use? What example would I, cite it like? Okay, so basically, someone is saying that the world is coming to an end. Let's just assume the new mother is saying this world will be like say Jesus dey come or something, and she just has that firm belief that the world is ending or that a war is currently happening in Nigeria. Meanwhile, Nigeria is normal. Jesus is coming soon, but we don't know. Something like that, and she's adamant about that. Or she dey hear things where everybody they hear. Okay, now this list. Okay, I'll keep quiet. That's silence. But this woman dey talk say no, be like say person dey talk, they tell her, they call her name. Let's say her name na Mama Beji twins. Beji is twins Yoruba land. So let's say Mama
Yeah.
Beji, Mama Beji, wetin do you sef? Be like say na only you get better husband. Be like say na only you man. And everybody's around her saying, you know they hear anything. You say no, person they tell me to come and they say Mama Beji. Say, madam, nobody they call you. Or as I dey sit like this, the woman come dey see say someone they sit beside me. I mean, like,
Yeah.
no, I'm the only one sitting here. And she's adamant, like the way I'm talking to you, that's usually the way they talk. Like, no,
Yeah.
like, no. So, like, you really have to understand that. They'll be like, okay, yes, I know, say two people they sit beside me, but this thing, that's how you have to talk with them because they can really be violent at a point. So, those two things, they hear things where people know they go see things where people know they see. Their
Listen,
own
that
thoughts,
kind
you know,
thing, they vex person sometimes. So
Yeah, that's
when you dey talk
in
like
fact,
this, a person go dey interpret them another way.
yeah.
Like you don't join double of you.
That even reminded me of a story I heard of a woman that was seeing animals coming out of the wall in her house and nobody else was seeing it. She had to like believe
Perfect.
the house. She had to like leave the house
Perfect.
thinking it was spiritual attack.
Anyway,
I'm serious.
Hey, that's so
I
perfect.
believe
Yeah. So
people they
that's a
follow
good
am,
one.
abi.
Yeah, that's a good one. Okay, then another one that is she's not able to bond well with the baby. Mama, you don't born now. Carry your pikin, breastfeed your pikin or something. She say, no, I don't want to touch him. You know, be like say his head they deformed. You know, they have suicidal thoughts of harming the baby. Be like say his head they deformed. Something they do maybe be like say make I kill him. Maybe if I kill him, his life go end well. He no go he no go suffer for life, something like that. They want to really harm that child because they feel like something is wrong with the child, something like that. So then also they are agitated, like madam, they calm down, say no, madam, they calm down now, what's happen? You know, so then sometimes they can have thoughts, they can have like they are not talking as usual. Just like the natural way I'm talking, I'm happy. I'm happy to be here. I'm excited. Just as I'm a new mother, she's just like, okay.
In our own world.
Are you okay, Mama? That's not normal. Then also that's Mama Benjamin, where they very quiet or where just they mind their business. All of a sudden, they begin to talk up and down. Just more social media than usual. They go everywhere. Mama, we don't born. They go, they talk, say one, travel. Madam, calm down now. You don't have baby. Say, no, I want it everywhere in day. Oh, and it's much more than normal. She wasn't like this when she was pregnant, before she put to bed. All of a sudden, someone that is meant to be racing her to be cooperating that she just boom, all they go around. Mama, it don't make sense. So. Then also, when she's confused, like she's not even oriented, we call it oriented the time, place, and person. Like she's just there. You're asking her question, she's saying something else. You know, is I don't know how to describe that. Like you usually be talking, just like I'm talking, you'll be talking to them. They'll be saying something, talking, okay, what's your name? Saying that I was with a meeting with what's the current president of Biden? I was with Biden in the White House. Mama Benjamin, how are you? I said, oh, fine. Where you doing now? I feel like saying now all akara in the chop. Mama, I'm talking to you, I'm not eating any food. You'll be talking, they'll be saying something else. Those are psychotic symptoms. So when you see something like that, my dear, just carry down, come and go hospital. Now, for Nigeria, where we did, people don't really know about mental health like that. They go think, say, maybe now.
Madness. They'll just conclude it's madness.
Don't think say na village people or na them they do am
Exactly.
say they
Na
don't
village
born, they
people dey do
want,
am.
you know, enemies of progress. Say they don't catch am.
We're just so backward in
He
Nigeria.
don't go do juju, the juju content, do backfire.
So usually they go carry those people go babalawo or ritualist or anywhere or
church. No, the most common place is church. Church.
The police station, church, mosque, you carry them go there far. You carry them go afar. Where they'll be doing incantations for them and be casting out and binding spirits. Or worse still, I've heard of a case where they carry this woman go police station and they lock her up.
They go flog them.
They lock the woman up until God just happened to a psychiatrist happened to be passing by. We're like, no, this is just postpartum psychosis. This woman is just has psychotic symptoms and they can be treated. And that was how she was able to get out. Lock her inside police station. You know?
Even locking herself will also increase her agitation. And they should just be shouting and then they'll not be saying yes.
Say, why
you they'll even be saying yes, it's mad.
Yeah. So so when you see all those symptoms, you bring them straight to the hospital. You take them to a layman's term, take them to accident and emergency, something like that in the hospital. There you have psychiatrists who are on call, doctors who will say, okay, so and I'm glad this program is being, it's made that way because there are a lot of people walking around on the streets whose minds are not sane.
Exactly.
Like literally. And I'm glad for the people that at least know it well by them to bring such people to the hospital, because most people just take them elsewhere. Where when you just hear, you just like, what is this? These people have just been treated with appropriate therapy, should be fine. Okay, so you bring such a woman to the hospital. So this is different in the case from postnatal depression and maternity blues. Those ones, they're just down. They can still talk to you. They are sane. Okay, they're just down. Most likely they've been dealt with depression before. Okay, and all that. Those ones are okay. Can bring them to the hospital, they'll be fine. With proper counseling, they'll be okay. But postpartum psychosis, all those symptoms I've said, those ones, you need to bring them to the hospital because it's an emergency. So when you bring them, the doctors will see them. Usually we admit such women. We admit them because sometimes we also find out if they have suicidal ideation, simply put, if they want to harm their baby, because some of them usually want to harm their baby, thinking that babies are deformed, that they will help shorten the baby's lifespan. Say, make I just kill you, make him suffer for life. Meanwhile, it's not, your baby is okay. Mama, not to do your baby, not to do now use something to make you treat you first. So then usually we'll see them, and when we assess them, we'll admit them usually, and then now. Sometimes we might, if the mother doesn't have any thought of having a baby, we might keep the mother and baby on the ward just to help them bond, so that mother and child, they go form attachment, something like that. But if mother won't kill her pikin, we go come out and we go give her go husband or whoever close to them that will take care. So usually we give them drugs, we give some therapy for them, do other things for them. And yes, they will surely recover. Most of them recover from it.
Okay, so now in the case whereby this one just give birth, he can start this one now. She go still leave the pikin with them. Abi make you collect the
It depends
pikin for hand.
it depends on how
on the
severe.
level.
You know, say some
Depends on
people
how
they
severe.
we say they get this psychosis where we say you go as even they try to come up pikin for hand. If you fight to join you.
Yeah. So that one, you have a way of removing the baby from the mother. There are just ways we do that. Okay. So we need a whole team, the proper nurses, doctors, and also other officials in the hospital that help with patients like that. They have we call it self-harm. Okay. We constrain them, something like that. We put them, tie them up, something like that, and then we remove the baby from them. There are usually people like that, patients like that are very aggressive. That one is so severe. Even normal adults will never stay with that person, not talk of a baby, innocent baby that she can just fling on the wall. Remove the child. But if it's just mild, can still keep. So it depends on whatever the patient is coming with.
Okay,
Yeah.
that's beautiful. All right, so the next question is, can postpartum psychosis be prevented?
Oh, wow. Okay.
That's really
So
a deep breath.